Welcome to Jones Physical Therapy Patient Stories. This is our Faces of Endo series. I'm Liz Jones, owner and pelvic health physical therapist. This March, in honor of Endometriosis Awareness Month, we're shining a spotlight on the journeys of women with endometriosis. We'll hear about their journeys, their challenges, their wins, so anyone who thinks they might have endometriosis or is already on that path feels seen, supported, and empowered. You're not alone, and these stories are here to inspire and educate. So today we welcome Ellie. I've had the honor of really being a part of her journey for the last year and a half. So Ellie, welcome. Can you just give us, I'm thinking sports, like give us the stat sheet rundown, if someone was kind of trying to scout the team, right? So give us a little bit of a rundown of you in regard to endo and your journey.
Yeah, so I am 50 years old. I'm married. I have one daughter. I would say, busy professional. I've worked most of my life and have a busy career. So I run a home, have a demanding job, and I had endo surgery, excision surgery about a year ago.
Okay. So And I'm having all of our interviewees kind of give us that stat sheet so that you as listeners can really hone into the stories that speak to you because there really are, again, many faces of endo. I think there's the classic red flags we hear about, like infertility or horrible pain with periods. So somebody who has multiple children might think, well, I don't have endo, I have children, but they might have three or four of the other flags. So thank you for coming and being open and honest and sharing your story with us. Let's go back to when you first came into Jones PT. What were your symptoms at that time?
Well, it's interesting because as I was thinking about this, I first came in because I had headaches and I was trying to figure out what's causing the headaches. And I think everybody, again, I think everyone thinks they're normal. And I thought headaches, everyone just has headaches. And I remember one day at work, someone had said to me, "You take a lot of ibuprofen and for your headaches." I thought, that's interesting. I thought, doesn't everybody pop ibuprofen like a couple times a day? And
Doesn't everyone have it in multiple
I
drawers in their
know,
house, in
yeah,
their car?
exactly. So that's what led me here. And then through the course of just coming in and trying to figure out what was going on with my headaches, then you start to have that conversation and you start to open up and have the discussion and understand that I have headaches. I've had my whole life since I was even young, in my teens, had, I would say, GI issues and really struggled with constipation, a lot of low back pain, constant trips to the chiropractor, and just kind of ebbing and flowing where I'd have my back would
Mhm.
feel good. And then all of a sudden I'd have a couple of weeks where my back was really stiff and sore. So there was that, probably even some other things that filtered into that. But I would say those were my kind of bigger buckets. Now that I say that too, I would say I didn't realize it, but probably pelvic floor too. So pain
Mhm.
during intercourse
Mhm.
was something that I was trying to figure out and deal with. So I think it started with the headaches. Then I think we started talking about pelvic floor, then the constipation, like all the things. We just started
Mhm.
having that conversation. And I think it started to paint a bigger picture when you look at them holistically versus one at a time or individually.
Yes. And like you and I were just talking before we started recording that you're normal. The comment you said. What was
Uh-huh.
that?
Yeah, like everyone thinks they're normal. These are
Hmm.
normal symptoms. And that's kind of why I mentioned I'm 50. I've worked, most of my life and I have a busy job. I have a busy home. And I think everybody a lot of my friends are in that boat where some of these symptoms, like the headache, well, no wonder why I had a headache. I was up at 6. I worked a full day. I came home. I made a meal. I did laundry. Everyone is busy. And that's kind of if you think about your circle of friends and the people you hang out with, and generally you're with like-minded people and people who are in the same situation you are. And you just think, everyone else is doing this and this is just
Mhm.
your normal, and we all think we're normal, but when you start to talk to somebody who actually knows and has the information, you realize that, well, this actually isn't, you shouldn't be feeling that way.
Yeah.
And two, I think turning 50, I think societally we hear people say, well, you're 40, you're over the hill, or you're 50 now, this is going to start to happen. So I think it's easy then to start to chalk up things to, well, I'm 50 now, so I mean, things are going to
Mhm.
start happening. And certainly that might be true, but it doesn't have to be in these cases.
Yes.
I think it's different too. I have one daughter and she's 22, and sometimes it's harder to explain away in young people.
Yes.
But when you get older, it's, well, I am 50, so things are going to start happening. But I think having somebody who's educated to tell you, well, actually, no, that's not normal. But you only know what you know.
Yeah. And it's your normal because you don't know. I have so many women with endometriosis who, when I ask, do you have painful intercourse? They say, no. And then after surgery, they heal. They are in shock at how intercourse can feel. And so it's one of those things where like, well, I didn't think I had pain, but I didn't know it could be this pleasurable or comfortable in a way. And I know we purposely are not doing video on these because I don't like being on video. And I think it's easier to get people to do interviews not on video. But I will tell you all, Ellie, to me, is almost the typical endometriosis patient that we see at the clinic, or I'd say the most common, because she is vibrant, she's happy, she's smiley, she has a good attitude. Kind of the comment she said earlier, the only thing people said is, man, you take a lot of ibuprofen, right? So even though there's a lot of health things going on underlying that are fatiguing, a lot of women that we see with endometriosis, they are driven, they are successful, they are hardworking, usually have a good outlook and are positive. So I think that's important for people to hear as we talk later about endo brain type things. So in your journey, when did you first even consider endometriosis as a condition or a condition that you may have or could be related to some of the symptoms you were having?
Well, it was really when I started being seen here for my headaches. I think just having those ongoing conversations. It's funny because I have a good friend who had been diagnosed with endometriosis, and she had mentioned it and we talked about it casually. So I had this peripheral awareness, but I didn't have a good understanding. And I think too, she was even trying to understand what her diagnosis was and try to articulate it to people. And I think if someone were to describe their symptoms, they might just, she was having infertility issues. So for her, when she talked about endo, it was all about her infertility issues. Well, for me, we had maybe had a harder time getting pregnant and had a miscarriage after my first pregnancy, but that really, I didn't have to go through any sort of, in vitro fertilization or any sort of stuff like that. So I would say it took us about maybe 12 months to get pregnant, but we got pregnant and we had a baby. And so when she talked about endo, it was all about her infertility. And I thought, well, I don't have to go through infertility treatment, so I don't have endo. And I think that's probably the biggest manner in which a lot of women talk about it. So when I came here and started treating for my headaches, and then we started talking about the connection potentially to pelvic floor and kind of all of that, it's like, and then the comment or discussion of endo came up, it was kind of like, well, I haven't had infertility issues, but there's so much more related to that. But I think that's maybe the one that most people know. So I think honestly, at first I was probably that's probably not right.
Yeah.
It takes a while to process, I think. So it took me a while to kind of think through that. And I think the fact that you come here and you create a relationship with somebody and they start to get to know you and understand you versus, my doctor that I treat with, if they had said it, I'm not necessarily going back to them a week later or 3 weeks later to continue my care. So we're not having that ongoing dialogue. So I think it maybe took a couple visits for us
I think
to
it took
just
several visits for you
process
to not completely zone out when I said it. Like, I don't know what you're talking about. I don't have endo.
That's, yeah. So I think it took a while, but just that ongoing discussion and conversation. And then sometimes I think too, we get so busy that we don't really pause to think, what is actually happening? And have I had that? And you forget. You just get so busy that you're not even paying attention. And then I think about my periods, again, had gotten worse. And again, I'm 50. I'm learning about perimenopause and menopause, and a lot of my symptoms, like the fatigue. I know I was chalking up to the fact that I'm going through menopause. Like this is the road, this is the journey, and it's a menopause related issue. And my periods were starting to get worse, and I would say kind of more impacting my ability to I was canceling plans. I wasn't going
Mhm.
places with my husband. I was leaving things early because my period was impacting my mood or how I felt, or I just needed to leave and go home because I didn't pack the right things that I didn't know I was going to need. So it was it was a journey. It took me a while to figure, like you, I think, connected the dots, but it took me a while to kind of follow you and then really, I think, essentially buy in. Because again, I think this is just a menopause thing, and this is just a you turn 50 thing, and this is what happens.
And you make a good point with your family doc or your primary care, or even when women go to their OBGYN, you had phenomenal relationships with those doctors, and you still have good relationships, and yeah, they're wonderful doctors. But like you said, when you go in for your yearly or when you're sick, you don't lay out, this is my day-to-day everything going on with me. It's, man, I'm still having some constipation issues. Okay, well, increase your water, your fiber, which is a very natural, or the talk of, yes, as we go through perimenopause, we have a decrease in estrogen, so our digestive system does slow down. Those are real facts. But like you said, it's different when you're like the way with us with the physical therapy, we do get to see you and follow up, and we get to start helping you see that, yeah, I had these weird back flares in the past. Well, recognizing those were always a few days before your period, most likely. And were they cyclic? And you're like, no, I don't think so. And then you start to think, oh my goodness, yeah, I kind of get this weird achy back pain. And then I know my period's coming in a few days. But when we are busy and we're wifing and momming and working, right? We just, gosh, my back
Yep.
hurts today, pop some ibuprofen and keep going.
Yep.
So I think that's a really good thing for women to recognize too, is just sometimes even write down when their symptoms are happening and how often. And if you don't mind me saying, one of the biggest things for me with you was the constipation piece, because you are a very healthy individual. You work out, you move, you eat well, you eat very clean. You were doing so many things that it didn't make sense that your constipation kept worsening, actually. So that to me was a big red flag. And then I believe we went back, okay, hold on, let's go back. What were your periods like? When did your GI symptoms start? And that's what, as a pelvic therapist who sees this a lot, that's where we start to kind of connect the dots and say, okay, wait a minute. And then usually my next step is, here's this book called Beating Endo. And I always say, read this with a gentleness, to not get overwhelmed that you have this horrible condition that you're never going to get better from, but read it with a gentleness to validate how much this condition can affect all the systems in your body. And it may or may not in different cases. So can you explain, when you started looking through that book, how did that help you? I think it's hard sometimes to accept that you have it because you feel like you can power through it. Does that make sense?
Oh, for sure. Because I've been able to power through a lot
Mm-hmm.
in my life. So yeah, I think reading that book was very interesting, and I think it validated the stuff that you were telling me. But then the way in which the book is written, there's these stories of these women early on, and it's kind of a varying age range, which is nice. And yeah, you can almost check as you're reading it, you're almost checking the boxes off in your mind to say, I have that, I have that. Maybe I don't have that symptom, but yeah, the book was extremely helpful. I think too, the other thing too, as I read the book, I I read the book thinking my mom is passed now, but my mom had endo, because I remember her talking about things like, oh, I don't feel well this way, or this hurts. And I just think I know my mom had this after reading that book, because there were other things that I just remember thinking, wow, this is, how did I not know this? So that book, it's funny, like, again, knowledge is power. And once you know better, you do better. But the book was very eye opening. And then I think after I read the book, I was, I think that was just the amount of time it took me to read the book was helpful, because that allowed me to process what you were also telling me. So then I think it made me feel better that if I'd read the book independently, I think if the random chance that I would have decided to read a book, which I never would have done, but on that topic, if you hadn't told me to, but I think reading the book, I would have gotten to the end and been like, I probably do have this, but obviously you were a critical part of that. And you were, so hearing it from you, reading it for myself, like, I think I needed all of that, because I think it is just kind of the, you know, toughen up kind of thing. And you'll be like, and this is just what it is. This is 50. So I think the book was extreme. I've given the book to my daughter's read it now. I passed it on to my sister-in-law to read because I think people they just need to know.
Hmm. Yeah. And this really is a perfect segue into what I call endo brain. There's probably a really great scientific term for it, but most women who have endometriosis start to have symptoms around the time they first start menstruating. And usually GI symptoms can start actually 1 to 2 years before they start menstruating. And so, like you just said, your normal is your normal. So, what I explain to most women is that you've always had probably more painful periods than is normal, but that was your normal. So, I often tell women, and I remember telling you this, is your 5 out of 10 pain is actually most women's 10 out of 10 pain, which in a way serves you well because this is where I think a lot of women with endometriosis are very driven. They're very successful in life. They are usually a little more selfless in nature because they're used to putting, like, they never actually feel well. So they're really used to saying, well, I'm fine and just carrying on. So it becomes, as a practitioner who tries to really work with people to listen to their body, it is interesting how there's almost this static and miscommunication. I tell women often it's kind of like you're trying to do the dishes and clean house, and your husband's talking to you, and you're like, yep, yep, but you're half listening.
Hmm.
That's what your body keeps giving these signals. I don't feel well. I'm sick. I'm tired, or whatever it might be. But if you actually stopped and listened to that every time it happened, you would not really function well in life because you often don't feel well most days. So I feel like there's this hard balance of validating that if I'm honest with myself, I don't really feel real great most days. Yes, you can put on a good face and smile and be positive and realize how grateful for you are for the many things in your life. But if you actually are honest with yourself, like, I don't actually feel well most days. And this is usually the question where I'll say to women, are you striving or are you thriving? Right? Like, and a lot of times by the time women get into our clinic, they are doing a lot of really good things for their health. They're eating clean, they're working out, they might be doing some acupuncture, they might be seeing a naturopath and doing supplements. And so they say, well, I'm doing okay. I don't think I need to do anything. Surgery sounds really extreme. And then usually we take that step back and say, look at what you're doing in a month to just
Hmm.
barely survive.
Hmm.
Oh, I said strive. I'm sorry. Are you thriving or surviving? I even said my words wrong there. So it's like you're doing all these things and actually you're just kind of surviving. Another key indicator for me with women, especially I feel like in this age range, is if I eat perfectly clean, really good, if I get all my sleep, I feel okay. Not even great, okay. But man, the minute I get overtired or I eat crappy, I am miserable.
Hmm.
I think those are some kind of big keys too. So the endo brain of, and then it's this, well, I'm not as bad as my friend. My friend couldn't even have kids. Like, I'm not that bad. I don't
Yep.
have endo. So the next step that we talk about usually, because the gold standard for endo is excision surgery with a surgeon who is resident trained and very experienced in it. So you had seen Dr. Duke, who we work with often. Just go through real quick in your mind what when we talked about, okay, that's the option. What were your thoughts and almost your reservations on surgery?
I think just processing that. I mean, I think for most people, surgery is kind of a big deal.
Hmm.
Just like, that's a big deal. So just processing that. And then Dr. Duke, not only would I have a surgery, but I would travel for a surgery. I
Hmm.
think that was the other thing that was like, is that really necessary? That seems, I think honestly, at first I was like, that seems kind of extreme. But then I think as I processed it, we travel across the country to go to a college football game, or we would travel across the country to go to an amusement park. So I think for me, it was not only surgery and then I'm going to travel to have it. That just seems like a lot. But then thinking about how you invest your time and your money, what's more important than your health? So
Hmm.
I think, again, that was just a journey for me to process. Is that seemed like a lot at first, but now looking back, it would have been foolish not to. And I mean, you know now what you didn't know. Hindsight's
Yeah.
2020, whatever. But I would do it again in a heartbeat without even thinking about it. But I think it was a process just to think through I actually also have somebody in my life who had surgery locally and, maybe didn't have quite the same results initially. So, I had had that frame of reference also. So when you had recommended Dr. Duke, I knew I had that frame of reference and I knew, okay, I should consider this as an option. Again, took me a while to process, but I would make that decision 10 times out of 10 again.
And at any point so surgery scheduled, at any point leading up to it, did you have a fear, oh my goodness, what if I go all the way out there and they don't find anything?
Yeah, for sure. Yeah, absolutely. And I think I'm sure you asked me that question because I'm sure you remember that conversation, but you had basically told me and kind of were providing comfort that it's not about going out and finding something, right? It's about you going out there and figuring out what's going on and knowing. So, and lo and behold, we went out there, had it done, and certainly there was endo, as you knew there would be. But I think it was kind of calming those nerves because it is a lot of to go through that process and to travel for that. And is this gonna pay off? Is it gonna be worth it? And am I gonna look foolish because it wasn't what I thought it was supposed to be? And so I think it was just kind of helping kind of process that it's okay if you have this done and you don't find what you think you were going to find.
Yes.
Even though we did, I think it was just kind of calming those nerves.
And I tell every woman who's thinking about surgery that you will have those doubts. You will have that fear. I have not had a single woman, myself included, that didn't go, oh my goodness, what if I go out there and there's nothing? And for myself, I was like, I'm really going to look like a fool when I'm the pelvic therapist. What if I go out there? And he's like, you don't have endo. We have yet to have anybody that has gone out there that has not had it that we've worked with. And what I think is interesting for women, I would say, I'm trying to think if there's any that go against this, but I think every patient I've had who's married, their husband is actually so supportive because your spouse is actually seeing how you suffer every day. They're the one who hears you say, I'm so tired. I just don't feel well. They don't get the face you put on when you go out in public, right? But what's interesting is it's often coworkers or maybe some acquaintances around you, and you mentioned, that might say, why are you going so far? That seems ridiculous. And I don't say that to be negative, but I think just it is interesting to me that husbands are usually like, no, whatever it takes, let's do it. We had a case where their insurance did not cover it at all. And she came in and she said, oh, my husband just wrote the check for, I think it was like $12,000. And she said, oh my gosh, I'm so sorry. And he said, are you kidding me? That's the best $12,000 I've ever spent. And we haven't even done the surgery yet. And to this day, he still smiles and says that, So it's interesting, I think, going back to almost that endo brain of, I'm fine. I can get through this. Oh gosh, this maybe is being a little bit overreactive or high maintenance, or this might financially stress my family, or, oh my gosh, I can't take that time off work. I'm fine. I can tough it out. I think that all kind of is a little bit of that. When you've had endo your whole life, pushing through is what has gotten you places and gotten you successful. So it's hard to step back and acknowledge that actually my body does need help right now.
Well, I think you get to be where you're on autopilot. And if you step out of autopilot for just a moment, things are going to start to fall. And I don't have time for things to start to fall. So that endo brain, I think, is kind of I just got to keep going. Otherwise, things are going to start to fall.
Yes. And the harshness to self of, if I could just stick to a diet, if I could just eat clean and perfect all the time, if I could just work out harder, I'd build my endurance, right? I think there's a lot of those things, and this is a comment we say often, is step back and see that there is this disease that is causing chronic inflammation in your body all the time that is actually undermining everything you're doing, right? And I think that helps to take that harshness away from yourself of, I'm a bad wife now, I'm falling behind at work, whatever it might be. It's just because there's a lot of areas this affects. So you had your surgery. How would you say your recovery went? And how would you say your life is now from a quality standpoint compared to before surgery?
Yeah, the recovery was actually fairly mild, I would say. I took a couple weeks off of work. I also had a hysterectomy at the same time. So I think that's the thing I've learned. I think it's everybody's journey is a little bit different. So I had the endo excision, but then I also had a hysterectomy at the same time. So
For the adenomyosis, for
yep,
those listening.
yep.
Yep.
So mine is just a little maybe different, but I mean, it was very, very manageable. I think I took 2.5, maybe 3 weeks off of work, just recovered. I would say my quality of life has improved significantly. I would say I'm just certainly, I think my husband would tell you I'm happier. I feel I'm more energetic. I have more, the fatigue is gone. I mean, certainly there's still fatigue, but if I get my 8 hours, if I'm eating right, doing the things I would normally do just to kind of feel okay, I feel very good. I have more stamina at the end of the day. I mean, I feel so much better. I would 10 out of 10 every time I would make the exact same decision. My quality of life has absolutely improved. And I think too, you and I talked about this, and I don't want to necessarily skip ahead in the conversation, but when I was thinking about having this, you had said, well, because we had started talking about my daughter. So I think for me, it was, I need to do this to figure out what's going on with me because maybe my daughter has this. So that was also probably a significant part of my decision. But,
Endo brain, I'll do this for someone else more than for me. But go on. Right. It worked in your favor.
Right. It did. So, but overall, the recovery was very easy. My husband was super supportive. Quality of life is so much better. I feel like this, I think before I was like, this is the way it's going to be. Like, this is what it is. And this is what I've got to figure out to deal with. And now it's like, actually, no, I can do more things now. I feel like I can sign up for more stuff. I can look ahead and think, what do I want the next 5 or 10 years to look like? Because I can design that now because I feel like I have the energy to do that. Whereas before, I wouldn't have had the energy, the stamina it was just about getting by. I feel like versus what am I actually going to do in the next 5 to 10 years different because I feel like I can do that.
Yeah. So just, you don't have to go into deep detail, but how about quality improvement of GI, back pain, and your ibuprofen intake?
Oh gosh, my back pain is non-existent. And honestly, that's probably the symptom that I feel was the most impactful to my quality of life because I did not realize how much back pain all the time. So if that is probably my biggest impact, I would say it's funny because I just thought it was a normal part of life, but I don't have any lower back pain anymore. And that's amazing.
Yeah.
So for sure, the back pain has been a huge improvement. GI has definitely improved. What was the other one you said?
Your ibuprofen intake.
Oh yeah.
Do you have stashes everywhere anymore?
No, it's funny because actually just the other day I said to my husband, I said, where's the ibuprofen? Normally I would have always known where it was. And yeah, and that's not good for you.
Right,
And that's not
right.
sustainable and that's not good for you either. So yeah, it's almost nothing anymore.
And with back pain, for those of you listening, when you're getting back pain a few days before your period, one thing we really cue into is endometriosis loves to be around your uterosacral ligaments. So that can be part of it, and just the nerves in the pelvis. The other thing too, as Ellie shared, she also had adenomyosis, which is where the lesions are actually in the muscle of the uterus. And that can give the uterus a really heavy, boggy feel. And that can also sometimes be causing pull pressure on the sacrum and causing some low back pain. So a little bit twofold. We have some young women who go in, they do not have adenomyosis, but they're having severe back pain and they're finding endo all around the uterosacral ligaments and things. So yeah, so a couple of reasons why she probably felt really good after her surgery in regards to back. Okay, what do you wish women knew about their bodies, their healthcare, et cetera? I know we've kind of touched on it, but if you could give a few words on that.
That's a really good question. I would say what I'm trying to teach my daughter now that I know what I know, I think, what would I want women to know? What would I want my daughter to know is you should ask questions. You should take the time to pay attention and investigate and figure it out and find somebody who can help you do that. Because I wish I had known what I know now 20 years ago, and how would that have changed things for me? So I've just got to keep going. I've just got to power through. Like, you actually need to pause and find something. Like, I'm lucky that I somehow in my journey landed here.
Mhm.
But finding somebody to say, can I just talk to you about what's going on? Because
Yeah.
nobody else, I don't know anyone else I can talk to that knows about this,
Yeah.
and that I can have an ongoing conversation. So that's what I would say is find somebody you can talk to like you.
Mhm.
And then I've had my body for 50 years now. And again, 2 years ago or however long our journey started, I think, how did I not know? No one had ever told me.
Mhm.
How are we, even like my daughter, her periods have, as a young child, were like in late elementary school, were significantly different than
Mhm.
mine. And I didn't know how to help her.
Yeah.
And I didn't know what questions to ask. And I just thought, well, maybe I thought I was normal, but then she started having her experience. And I was like, well, maybe that is normal. And then, you just don't know. So I think taking time to educate yourself, find somebody
Mhm.
like you who can help you along that journey and give you the nuggets that you need to investigate and start really just understanding your own body.
Yeah. And the conversation piece, like we talked about, sometimes when you have endo or you are just busy in life and not just endo, it is like the kind of trying to do 100 things while you're saying, yeah, to a conversation rather than when you say, okay, hold on, let's sit down and look at each other face to face and talk. So many of us, men and women, go through life just kind of nodding and agreeing with our body when it gives us signals. So that really stopping when you're like, man, I don't feel well, and saying, okay, body, what what are you telling me? Which, like you said, is and then it's hard to find someone to seek for medical care with that. But we do have great practitioners in this community in our family practice docs and everything. I think sometimes even as patients, it's hard to articulate. Actually, I don't feel well all the time because we're like, okay, yeah, I'm fine. This is normal. So it is that you're not being whiny. You're not. It's crazy how many times people will come into their visit with me and I say, how are things going? How's your body? Is usually what I say. And they'll rattle things off and they almost always apologize for complaining. I'm sorry, I'm just complaining. I'm like, you're not.
Mhm.
You're telling me honestly, how has your body been in the last week? Because that's how I know what's working, what's not. So I think when you go into your practitioners, write down, these are the things that I'm noticing that aren't well right now. And you're not complaining. Like if you just say, I'm just kind of constipated, right? They don't see that whole picture, right?
Mhm.
We do know that if there is a maternal component of endo, so like for you, your mom had endo reading this, you have endo. We know that if maternal endo is present, there's a 70% chance that the daughter will have it.
Mhm.
And we know that paternal, if there's presence, so that means if your husband's sisters or your husband's mom had endo, that there's a 30% chance. So kind of a little unique situation with your case in this interview is that you do have a daughter who, as you said when you were working with us here, she was struggling. Do you just want to give us a quick overview of kind of what her conditions were when she was younger, while we were treating the things that you went, oh my goodness, she's got to have this, and then kind of where she's at now?
Mhm. Yeah, so my daughter Ava is 22, and she had from the first time she got her period, she was in late elementary school, early middle school, and it was horrible. And so really bad periods, throwing up as she's, aged, major constipation issues as she's gotten older, a lot of back and hip pain. So I was kind of like, that's been ongoing for the last probably about 10 years as I've been trying to figure out as a mom, how do you help your young daughter manage her
Mhm.
periods when she can't make it through a, in elementary school, they have to raise their hand to go to the bathroom. So how do you help your kiddo make it through the day between restroom breaks and manage that? And that was very challenging. So when I came here and started learning about this, I knew right away that Ava had it. And once I had gone through my own journey, I had said, absolutely, I need to do this because I need to figure this out for Ava. So actually, Ava just had surgery a couple weeks ago. So in 12 months, her and I have both been out to see Dr. Duke, have both had surgery. And Ava, I'm just so relieved that we did that. Her case was, there was more endo they found, and she had a lot of endo around her bowel. Certainly, Dr. Duke had said that if they hadn't found that and done the work that he needed to do in 5 or 6 years, she would have had some sort of a significant event that she would have had to deal with, and there would have been additional surgery required, just not necessarily to deal with endo, but to deal with the issues with her bowels. Like it was significant. So that obviously is a huge relief. We didn't know that, but that was a huge relief. And then certainly, I think as Ava's only 22 and she decides at some point she wants to grow her family, she would have had, I think, significant issues trying to have a family. So I think just the relief and the just the relief knowing that she is going to be saved from a lot of heartache, a lot of pain, just figuring that out. Like I think my journey now, Ava, I feel like I have the cheat code now because she is going to, I think I can't wait for the next maybe 5 months for her to, like, how do you really feel? I think her quality of life, just, talking to her as she's a student, talking to her on the phone and listening to her about how to describe her day, what she was coping with and dealing with and how she felt. And you could just see it in her face. You could just see it and hear it in her voice that she was not feeling well. So for her, I'm super excited because I think she is going to feel significantly better and have just an incredibly different journey than she would have had if we had not done it.
Yeah. I often tell patients the visit before they go to surgery, I always say, I can't wait for you to be on the other side of this. And again, it's not going to 100% fix every single issue patients have. But again, it takes this huge underlying factor out that is undermining everything. Any other last words you want to say?
Just a big thank you. You've been so instrumental in my health, now my daughter's health. So just a huge very thankful and huge thanks to you.
Yeah, you're welcome. I'm honored. It's one of our biggest passions here right now is changing the narrative of endo and raising awareness, because it can get really hard when you have a week where you have 4 or 5 patients in who are in their 40s or 50s and have really struggled for half of their life. And so again, we get to also have the honor of getting to journey with them and seeing them on the other side, right, of surgery, which is fun to see that light come on and the joy. And so yes, we're honored and thank you. And thank you again for taking the time out of your day today to share your story, because it will help many other women. So those of you listening, pass this on if you hear the story of any of your loved ones in this. And like I said, we'll keep bringing you stories from women. EndoND.com. So EndoND, like North Dakota.com, is also a website where we're trying to build more practitioner network type information for patients to have a one-stop shop to get information and also build their own team. So thank you for joining us.